Welcome to The Explainer. Today, we are skipping the small talk and getting right into an architectural tour of the face's median wall. Yep, we're talking about the nasal septum.
So, have you ever wondered why you suddenly get a nosebleed out of nowhere? Or, why one nostril always seems just a little more clogged than the other? Well, we're going to reverse engineer those incredibly common daily experiences by taking a look at the fascinating, unseen internal anatomy right in the middle of your head.
Section 1. The Great Nasal Divide.
Okay, let's dive into this. By definition, the nasal septum is a median osteocartilaginous partition between your right and left nasal cavities. Try saying that 3 times fast. But here's a really surprising fact straight from our source material. Despite the name implying a perfect center, it's actually almost never exactly in the middle. In fact, it bulges way more frequently to the right side. So basically, most of us are walking around with a slightly asymmetrical structural wall on the inside of our faces.
Moving on to Section 2. Building the septum.
All right, let's do a little architectural breakdown here. Think of your nasal septum kind of like a house. The back of the wall is rigid, acting a lot like solid drywall. This is the bony part, made up of the perpendicular plate of the ethmoid bone up top and the vomer bone down below. But the front of the house needs to weather the storm, right? So it's made of flexible building materials, which is the cartilaginous part. This includes the septal cartilage anteriorly and the septal processes. It's really this perfect biological blend of stability and flexibility.
And this brilliantly illustrates exactly what we're talking about. Notice how the vomer and the perpendicular plate of the ethmoid form that rigid back wall. Now, looking toward the front, you can see how the medial crura unite to form the columella. Plus, there is a highly flexible membranous septum at the very bottom with absolutely no bony support at all. It's just an incredibly elegant structural design.
Section 3. Plumbing and wiring.
But hey, a house isn't just framing and drywall, right? It needs internal utilities to actually function. So when we look at the quote-unquote plumbing of the nasal septum, the arterial supply is honestly staggering. Check this out. We have the anterior ethmoidal artery, the posterior ethmoidal artery, the sphenopalatine artery, the greater palatine artery, and the superior labial artery. All of these rapid-fire right into this single structure. It really emphasizes just how highly vascularized and resource-heavy this relatively tiny partition of your face truly is.
Now here is a golden fact to remember. Out of all those arteries we just listed off, the septal branch of the sphenopalatine artery is uniquely known as the rhinologist's artery. It is absolutely the most critical artery for ear, nose, and throat doctors to know and manage.
Okay, so moving from the plumbing to the wiring, let's map out the sensory network. The nerve supply here is highly specialized. The top 1/3 of the septum is wired strictly by the olfactory nerves, so that's your sense of smell. Meanwhile, the rest of the wall is serviced by the internal nasal branch of the anterior ethmoidal and the nasopalatine nerve, which handles general sensation. It's just a really clear, optimized division of labor.
Section 4. The epistaxis danger zone.
All right, I'm going to put on my friendly cautionary doctor hat for a second here. What happens when the plumbing of the nasal septum gets disrupted? Well, right in the anterior-inferior part of your septum, just above the vestibule, is a critical danger zone, medically known as Little's area. This is where those arteries we talked about earlier all meet up at an anastomose to form what is called Kiesselbach's plexus. Because it's so incredibly vascular and sits right at the front of the nose, it is highly vulnerable.
And unfortunately, that vulnerability leads to the absolute #1 cause of epistaxis, which is just a fancy medical term for nosebleeds, right in Little's area. And the cause? Fingernail trauma following picking of the nose. Yep, that beautifully complex vascular anatomy we just mapped out is most commonly disrupted by the universally understood childhood experience of digging for gold.
Section 5. When the septum deviates.
So, the crucial point here is what actually happens when this entire architectural structure fails, gets damaged, or just naturally leans way too much to one side. Let's walk step by step through the clinical reality of a deviated nasal septum, or DNS for short, which, fun fact, statistically affects males more than females. It usually starts with step 1, trauma or a developmental error. This leads directly to step 2, a mechanical obstruction of the airway. Because the air just can't flow properly, we hit step 3, which presents as excessive snoring, headaches, and sinusitis. Finally, if the architecture is failing severely enough, we arrive at step 4, surgical correction. This is usually a submucous resection or a septoplasty to physically go in and rebuild that central wall.
But, of course, surgery comes with its own structural risks. Because the septal cartilage acts as the major load-bearing pillar supporting the front of your nose, removing too much of it during a septoplasty can cause the roof of the whole external nose to physically cave in. In the medical world, they call this a supratip depression. Basically, you literally lose the support beams of your face. Yikes.
It's honestly amazing how much is going on inside such a tiny space. The nasal septum truly is the unsung architectural hero of your face, perfectly balancing rigid bone, flexible cartilage, and some incredibly dense plumbing and wiring. But I want to leave you with this provocative thought as we wrap up today's explainer. Considering what we learned about its natural asymmetry from our sources, is yours leaning to the right now? Thanks for exploring with us today, and keep asking questions about the amazing structures hiding in plain sight.